I'm kind of in a little bit of a unique situation. This all happened to me over a period of about 22 months. September of 2018, I had an implant. Everything was great up to 5 months. 5 months after that, I experienced a severe infection. I went in for my 1-year exam to see the infectious disease guy, and I still had an infection. At that time is when I came to see Dr. Bowler, and we did a permanent replacement. I was in the hospital one day for that, and I've been doing very well since then. I've got good range of motion, and Dr. Bowler and I are both very, very pleased with how it's progressed and where I stand right now. I came out, I basically used a walker to walk down to leave the hospital, and it was the last time I used it. And I was able to do activities around the house within a day or two. I actually mowed the yard, I think, 3 days after I got out of the hospital. And really no problems with my knee. I've not experienced any severe pain. He's a great guy, young, energetic, very positive. He always told me what was going on. I learned more probably in the first visit I had with him about the infection that was in my knee than I had in the previous, well, been 13 or 14 months. Everything's been positive, very positive at this point.
Using a multidisciplinary team or a team-based approach, we're able to cure his infection and get him a new knee replacement. What we found is through this multidisciplinary team, the recovery is just extremely enhanced. And so he was able to get up and actually was mowing his yard at 2 weeks after the revision knee replacement went in, and he's been really enjoying his new knee and all the things he's been able to do. So it's so fun and rewarding to see a person like Mr. Cowles who comes in, he's just dejected because he's in so much pain and nobody's able to help him, and he's got an infection in his knee, which potentially you could lose your leg from something like that. And to be able to cure his infection and fix him to the point where he's able to get up, do everything he wants to do, and get back to mowing his lawn and enjoying his life and really having a pain-free, functional knee, that is so rewarding because it restores his mobility in his life. It's just such a delight, and that's what motivates me to come back every single day and do the best that we possibly can for our patients.